Hello, everybody. Welcome to another episode of the Find Your Model Health podcast. I'm your host. I'm Shemaine Linney. I'm a nutritional therapist, integrative health practitioner, and certified iridologist. I'm very happy to have you guys back with me for another piece of your day. We have another special guest on the show today. I'm excited to bring this conversation to you all because I talk about this topic and I know many of you are interested in it. But before I do the introduction, I'll remind you that the information in these podcast episodes is for informational purposes only and should not be taken as medical advice. Please consult your health practitioner before making any lifestyle changes. So today we are chatting with Dr. Jeffrey Gross. He is founder of Recelebrate and a pioneer in the field of regenerative medicine. So Dr. Gross graduated from the University of California, Berkeley with a degree in biochemistry and molecular cell biology. He earned his Doctor of Medicine in 92 from George Washington University School of Medicine. He has contributed to virology research during his studies. After graduating, he undertook a residency in neurological surgery. And I know a lot of you are going to be interested to hear what he has to say here. He then pursued a fellowship in spinal biomechanics at the University of New Mexico. And then he has also spine practices in Nevada, where he currently resides, if I'm correct. He's a trained neurological surgeon. He specializes in athletic injuries, spine procedures, and offers lots of valuable information on longevity and biohacking. And he's going to specifically speak to us about stem cells and regeneration today. So, Dr. Gross, welcome to the show. Thank you.
Thank you so very much. I'm honored to be here.
You're very welcome. So I'm looking forward to this conversation. But before I go on, you've clearly got an extensive resume. Why medicine, and why transition then into the longevity and stem cell biohacking area?
Well, the first part was I was always meant to be a doctor. I mean, from my early school years and into high school, I just knew that was my path. I enjoyed the biological sciences most of all the sciences, and being science oriented. And I just was inspired in that way. And then in college, I had some influential people who, really taught me about doctoring. I want to tip my hat to my mentor, Dr. Stephen Holtz. And then in my residency, I just met, wonderful people who passed on traditions of how to be a doctor. And one has to work very hard in the face of all the economic pressures in medicine, whether you're Canadian or in the US or elsewhere. Medicine is so watered down by those people who make money on it, namely the third-party insurers who suck the revenue out of it. But the answer to your second question is, why did I transition from traditional medicine to cutting edge, biologic medicine is I was frustrated. I was treating patients. I think I'm in my 26th year of treating patients with neurosurgery problems of the spine, neck and back trouble, complex problems, simple problems, and there are some tiers of treatment, and the first tier is sort of time and therapy and anti-inflammatories, and the second tier might be pain management for injections, and the third tier is usually surgery if you fail tiers 1 and 2. But there's a big gap in tier 2 to tier 3. So patients would say, "Doc, the injections help temporarily, but they're not worth doing in some cases." And then we talk surgical options, and they'd say, "We're just not ready for surgery. I'm not that bad." So they're stuck with this pain, but not something they can do about it. So they would say, "Doc, what about stem cells? What about this? What about that?" And after hearing that enough times, and not having any tools to help fill that gap with some less invasive treatment that made sense, that didn't involve potentially putting screws and rods into someone's spine, which is a big deal.
Yeah.
I finally stopped going to these annual neurosurgery conferences and said, I'm going to try something different. And I went to regenerative medicine conferences. And then I got interested again because it took me back to my roots in my education and in molecular biology and biochemistry. And a lot had happened in the 30 some years since I went to college and in the stem cell field. And it was a chance for me to go back and say, okay, that field is ready for me now. So I got trained, I educated myself, I read, I went to these conferences and started applying regenerative medicine with the goal of offering it to my spine patients. But because regenerative medicine, and we use the word regenerative to include stem cell based medicine, because that medicine overlaps with all kinds of regeneration of the body and slowing the cellular aging and the anti-aging biohacking community, I'm doing much more than just treating spines now. So that's the evolution. Sorry for just rambling on.
It is, well, you're correct. It is more than just treating spines. Like, you're enhancing one's overall quality of life on every level. And I don't think people see when they see a specialist who knows what they're talking about and doing what you do, it's not just, oh, I'm helping your spine or making your back feel better. It then has a huge ripple effect throughout the rest of your life, which is amazing. So stem cells, peptides, PRP injections, all really hot topics now. But again, they're clickbait. They're keywords that people are using. A lot of people don't even understand what they are. They just hear it through the gym or the grapevine. So can we go back a little bit with stem cells and just explain to the audience, what are stem cells?
Sure. Happy to do that. So stem cells are cells that created us in the first place. When we were an embryo, first fertilized egg, and then we divide into 2 cells and 4 and 8, etc., into the embryo. Those are stem cells. They have not yet received a final job assignment as to what type of tissue they're going to be in your body. Are they going to be a brain cell or a liver cell or a bone cell or something like that? And we, as adults, once we stop growing, continue to retain stem cells to help us heal, to help us regenerate and recover and maintain as needed. Those cells get exposed to the same stressors that all of our cells get exposed to during life. What's in our water, what's in our food that isn't great for us, what's in our lifestyle. So we'll call these, sort of the epigenetic factors. And these cells, our stem cells, become less functional with time. And an example of that, Shemaine, would be if you take a 3-year-old who scrapes his knee on the sidewalk, and the mother cleans it up, puts a bandage on it, kisses the boy, and sends him on his way, go back and play. And then 3 days later, the bandage comes off and the scab is almost completely healed. Like, wow, that was fast. Whereas you compare that to a 75-year-old who bumps his elbow on the door frame and then has a 2.5-week bruise and discoloration. I mean, why doesn't that same person with the same genes and same cells heal as well as he did when he was 3? And the reason is the stem cell activity just isn't as good. So these stem cells...
Is that partially because of aging, or all the different lifestyle factors over the 70 years?
Well, I think the paradigm is aging is the exposure to all these lifestyle factors over the years. Aging is an accumulation over time and amount of chronic inflammatory change, degradation, and deterioration of cellular function. And we accumulate useless cells called senescent or zombie cells. Our autophagy, where we recycle cells, becomes less useful. And part of that is driven by stem cells. So our stem cells face the same problems. We have senescent stem cells, and they just don't regenerate us as well. And lifestyle factors and epigenetics, meaning how healthy we are, just living like our grandmothers told us to live, determines the functionality of our stem cells over our age or life, and how healthy we will be in that later years, which is why we like to use the phrase or words health span, meaning a longevity that's healthy. Because you could live to 100, but if the last 20 years you're in a nursing home, that's not great. But if you live to 100 and you're only infirm for the last 6 months of your life, that means you filled your lifespan with health span.
Do you feel that the regression of stem cells as one transitions through their life is definitive, or can it be slowed down? Can you maintain the same stem cell health as I could now in, say, 30 years?
I think there are new strategies on top of old strategies to help improve your stem cell activity as you age over 30 years and slow the age process upon them, which means you're slowing the chronic inflammatory change. And that comes through mostly willful choices in diet, not just what you eat, but when you eat. I know you've had guests on about fasting and things like that. Other forms of hormesis, meaning mild stressors on the body and its cells to build resilience. Fasting or calorie restriction being one of them. You could add certain types of exercise, hot sauna, cold plunges as others, other forms of hormesis. And then, other important optimization lifestyle features like, proper restorative sleep, the right supplements, again, back to exercise and movement, things like that.
Yeah. Have you heard of a guy called Brian Johnson? He's making a name for himself in the biohacking world now.
Yes.
Basically reversing his age, but he's spending $2 million a year on his health to pretty much reverse his age. If you've seen him, he has a different look about him. He looks very elvish, like he came out of Lord of the Rings, and that's not an insult. I don't know how else to describe it, but he's doing, of course, stem cells. What is he? I think he's either vegan based. He avoids the sun. He will not go on this, like he's extreme biohacking at this stage, but he's doing some stem cell work from my understanding, like regularly.
Right. So, he has the ability to do that. He's outspoken, and he's helping push this field in a good way. And we are all biohackers of sorts. Think about it. If we decide we're going to eat healthy, we're biohacking. If we decide we're going to not eat healthy, we're biohacking the wrong way. He has the ability to do this, and it's very interesting what he's been doing.
Yeah. And I've watched a couple of his interviews, and although it's interesting, it's not something that I would be drawn to do, because I in my opinion, I don't think he's living life in the way it's supposed to be lived when you're living that restricted and that confined and that regimented. Maybe each to their own. He probably loves it, but for me, it wouldn't be I'd rather live my 90 or 100 years healthy and strong than live to 150 and not have lived at all. So
excellent point.
Something funny that I wanted to say as you were describing stem cells. I have a little boy, he's 11, and this morning on the way to school, I said, "Oh, I'm interviewing a guy today, a doctor, about stem cells." And he said, "What are stem cells?" I was like, okay, how do I explain this to an 11-year-old? So I said, well, we have cells in our body, and every night we make new cells. And I said, they're like blank boards, and they will go wherever your body needs needs it to go. So if you cut your finger, then your body needs stem cells there. And that was kind of how I described it to him, because he's getting into health and has these questions now. He actually, because his mom is a biohacker, he asks questions that other 11-year-olds don't ask.
I love it.
So one thing I've done, this might just be interesting for you as well, when I've spoke on a basic level about stem cells to my clients and followers, I've mentioned, hangnails. If you pull a hangnail and it's deep enough and it bleeds, let's say I do it tonight and I wake up in the morning and that's healed, then you've got a good indication that your stem cells are pretty good there. Whereas if it takes days and days, you could probably do it a little bit of work. So good news for me is if I get a cut, it'll be healed in 24 hours. So pretty good, I think.
Yeah, that's an absolutely perfect example of your stem cell activity. And thank you for that, because you're right. It's just like the little boy who skins his knee and the old person whose bruise lasts forever, right? This is exactly what's happening. And focusing on your cellular health focusing on your cells will take care of you.
So you specialize in regenerative treatment using stem cells. So what exactly is that in what you're doing?
Well, there are 3 different levels of stem cell based medicine, if I can explain briefly. The most basic level is called PRP, or platelet rich plasma. And this is drawn from your own bloodstream and spun in a centrifuge. And the platelet the platelet and the growth factors are collected out from that spin, separate from the red blood cells and the plasma, which is sort of the liquid in the blood. And these platelet-rich factors can be reconcentrated and delivered back to your body. For example, if you have tennis elbow or some kind of tendon or something orthopedic related, you can inject this over a series of 2 or 3 sessions, and that will help concentrate some of your body's healing, more acute inflammation, which is good for healing, not chronic inflammation, into the right place. So that's sort of the very basic thing you can do. Most doctors will offer that. The next level up from there is skipping right to stem cells. And stem cells have 2 sources: your own body, which can come from various places, but the richest source is your bone marrow. And those can be harvested. That's not necessarily pain-free to harvest. And they can be prepared and redelivered back just like PRP. Or you can get a much more youthful source of stem cells, which in my mind have much more bioactivity, and that is from perinatal source, meaning after birth. So what used to be thrown away after a mother delivered a baby, placenta, umbilical cord, amniotic fluid, this used to be biological trash, is now biological treasure. And there are many labs in North America and other places that will collect these. They will test and screen them and prepare them for use. So that's the source of stem cells. But about 15, 16 years ago, a wise scientist tracked these stem cells. We'll call them stem cell graft. Tracked a stem cell graft that was delivered to someone intravenous, and found that those stem cells only lasted 10 to 14 days. But the regenerative ability of those cells to help affect the recipient lasted weeks and months. And
signaling factor was there, and it had pretty much barcoded itself onto the genetic and protein expressions.
It had, but that's exactly right. But the way that the recipient cells made those changes or accepted those messages was because those stem cells that they received delivered cell-to-cell messengers. And we call those extracellular vesicles, which are very small particles that one cell gives off to its neighbors. And it can deliver thousands, each cell can deliver thousands of these each day. And those neighboring cells receive this message, and it has small microRNAs and growth factors, and it tells those receiving cells to make those behavioral changes, to change which genes, like you said, are being called upon, to focus on repair, regeneration, and restoration, as opposed to degeneration and defense mode.
Yeah.
And so basically shut off the chronic inflammation and go back to optimal factory settings. and that's where we're getting the benefit is I have found that the third level of regenerative biologics are delivering these extracellular vesicles directly, skipping the middleman, the stem cell. And we like that for a couple reasons. One is these small particles can travel further in the body. They don't get as hung up in the heart and lungs when delivered intravenously. They do cross the blood-brain barrier for people who need that kind of regenerative message to the brain and spinal cord. They do tend to last longer, and we can get a more concentrated dose. And would you believe they're about half the price of stem cells? So I'm a bigger fan these days of using this more advanced delivery of the exosomes, sometimes called nanoparticles, to deliver the stem cell message without even bothering with the stem cells.
So are these stem cell messages derived then from placenta and post-birth treasures? And how are they being delivered? Is this IV as well?
Depends on the issue. So here in my hands, for the biohackers and the group who's focusing on anti-aging, those who may have an autoimmune issue, want to help reduce their inflammation, certain infections, certain recovery, if they want help recovering from a heart attack, improving heart function or brain function after stroke, or some type of inflammatory dementia like Alzheimer's, we tend to go with IV. IV. If it's an orthopedic issue, we are actually seeing some cartilage regeneration in joints, following some wonderful studies out of France that are now in their 17th or 18th year. So we're just slow here in North America. But those are delivered directly to the body part, whether it's the knee, the hip, the spine, the ankle. And then we have some cosmetic and procedures for thinning hair. And for sexual function, we have some boy and girl shots.
What about bone regeneration? Because I have a couple of clients concerned about bone loss and regression post, as we spoke about at the beginning of the call, post chemotherapy and radiation.
Right. So I've been reluctant to use regular exosomes derived from stem cells for anyone who's had cancer, because I just don't have enough experience and don't want a cancer to accidentally go crazy. So now, having said that, I am pursuing some research in the area of exosomes derived from NK cells. And NK, you and your audience may know, stand for natural killer cells. And these are the cells in our body, in our immune system, that tend to weed out cancer cells. So I'm looking into that. It's not yet available here anyway. But separate from the post-chemotherapy group, if someone's in, or someone's in remission long enough, there is evidence that exosomes will stimulate bone marrow health and bone density. And as you and your audience, I'm sure, knows, the longevity organs are bones and muscles. And if you maintain your bone density, you don't get osteoporosis, and you maintain your muscles through exercise, you release myokines and little particles from the muscles that stimulate the brain to be healthy, that slows the progression of dementia and improves the overall health. There are other studies that show that use of these stem cell derived exosomes do help support bone density. Now, that's difficult in a postmenopausal group, and often optimization should require some evaluation for hormone optimization, vitamin D, and and these are and exercise, of course, are the factors that stimulate bone density. So there can be a role for these, but we have to be very cautious in the people who have had some cancer, unless it's complete remission.
Mm. So if one was to do that, we're looking at the age, the individuality. Do we need to also complement it with some bioidentical hormones? And yeah, that's very helpful because I know people are interested in that. For myself, if I was to do something like this, it would be more the anti-aging and longevity aspect. So for people like me who are more not to say vain, but we care about what we look like and we want to maintain it. What kind of results can people see? Like, what's your experience here with this?
Well, for our group of people, and I'm one of them, that is doing this for an anti-aging, or I'll call it a preventative means, we tend to see, at least for 3 or 4 months after an IV approach, reduction in aches and pains, improvement in sleep and in energy, improvement in cognitive function, improvement in recovery from workouts. We have other people who have, little different things they've reported, like improved libido, improved metabolism, reduction. We have some, type 2 diabetics who have improved blood sugar. And these are people who have had no particular disease or pathology going into it. So we do have others with a disease or pathology we've tried to assist with and have had some interesting benefits, coupled with kidneys failing, that we've been able to help. Again, recovery from heart attack. Heart function is significantly tied to stem cell activity. And the stem cell derived exosomes do stimulate and activate one's own sleepy, aged stem cells to act in a more youthful way. This is basically a dose of youth. And there are studies where they take young mice and old mice and they exchange the blood. And this is kind of like that. And they're getting the exosomes, the old mice is getting the young mice exosomes and acts more youthful and lives longer, and vice versa. The young mouse gets the old mice exosomes and behaves more like an aged mouse and doesn't live as long.
The sleep optimization intrigues me because I wouldn't have connected it to sleep improvement, but I'm assuming that's because of cellular metabolic health improving, and the not only that, but if I'm correct, cognitive performance improving, and also I would guesstimate the cell's ability to utilize vitamin D better.
I would think all of the anti-inflammatory (anti-aging) metabolic pathways are enhanced when they receive the youthful messenger signals coming from stem cells or stem cell derived exosomes, because it activates those pathways in the cell. So I would agree with you that it would include, better use of vitamin D3. It would include reduction in all the pro-inflammatory defense pathways that tend to gunk up our system. And it would improve, restorative pathways, production of antioxidant enzymes, so tapping back into the DNA repair enzymes that we make, things like that. I would agree.
So this sounds like it would be prime for most people, dare I say, who have chronic and systemic inflammation and autoimmune issues and all these different illnesses that society is plagued with now. I have a lot of clients and followers that I know are going to be very interested in this. And of course, Nevada is not very far for us. Canadians, of course, love to go to Vegas regularly. But for people who have autoimmune issues, Crohn's, MS, so-and-so, how do you approach them with this, and what can they expect? And also, in how long can they expect to see results?
Well, you're right that our favorite patients and those who probably get the biggest response are those who have a hyper-inflammatory burden already, and those are those with autoimmune problems, and or certain infections that are known to have a significant inflammatory burden. Let's name two of them that are significant: Lyme's disease and COVID-19. Both are known to have a significantly out of proportion inflammatory response. Now, everything I say here, of course, is, like you said, for educational, informational purposes. And here in the States, I am unable to make any claims. The government has made that clear. The FDA says that stem cells and or exosomes are not approved for claims. So anything I say here is to help people with their situation, but I can't say I can cure or treat a disease or condition. So I'm not trying to imply that. But given that cautionary proviso to make sure we are always compliant, I would tell a patient that this would be something to try as an adjunct to whatever else they're doing that their doctor is suggesting. They can try it as an alternative. Because it's not approved, some people define that as experimental, although there are wonderful studies to support this. This is not just shooting from the hip. Most of those studies, Shemaine, come from Asia and Europe. Okay. We're a little slow here in North America to adopt these things. But we don't do anything, shooting from the hip. We do it based on good science somewhere.
Yeah.
But these patients are interesting because they are the group that might have a couple of days of a side effect. And that side effect after doing this is they will have a flu-like syndrome. And if you think about the flu, you get muscle aches, joint aches, you get fevers and chills, you feel yucky, you get tired. And why is that? Because your body's releasing all these cell signals that it's stored up that are calling the immune system. They're activating the immune, the response, the defense system. Call the alarm, and it takes a day or two for those proteins that get released. Because when we flip the cell metabolism from inflammation defense mode to youthful, better optimized metabolism mode, the cell has to do something with all these cytokines. So it purges them, they get into the bloodstream, and we have these symptoms. And they clear out. It's not the flu, it's flu-like. And you think about it, when you have the flu, the same thing's happening. Your cells are infected, they're releasing all these defense things, and you get these symptoms. So the people that tend to have more of those side effects for the first few days tend to have a better result once they're gone.
Is that because they feel worse in the beginning?
Correct. They stored up so much inflammatory burden in their bodies from these hyperinflammation situations, whether it's an autoimmune, a rheumatoid arthritis, a thyroiditis, Crohn's disease or irritable bowel, psoriatic problems, or these infections we talked about that have the hyperinflamed state, that we're flipping a bigger switch for them.
Yeah, that makes sense. Wait, I discuss molecular hydrogen a lot with my clients. I'm a huge fan of it. I would love to get Tyler LeBaron on the podcast. But with molecular hydrogen, if you are healthy and do not have systemic inflammation kind of hounding you all day, you'll take molecular hydrogen and you'll say, well, I feel nothing. But that doesn't mean it's not working. But those who have the worst symptoms and systemic inflammation, they will take it and feel an improvement immediately. So it's funny how I feel, because people feel so bad, that when you do make them feel a little bit better, they feel it immediately, whereas I'm like, no, I just feel the same.
That's a wonderful point. And we do have biohackers, and I'm one of them, who do the IVs on a regular basis. And I had more response that I felt after the first one or two, and now I'm already hopefully maintaining a lower state of anti-inflammatory nature, that I don't feel much of a difference. However, we do have markers for this.
Yeah.
I had one client who had an IV and said, I really don't feel much at all. But then a few days later, he sent me his HRV. And I don't know if that you've done this on your podcast. You have. So I love health metrics. Heart rate variability, or HRV, is one of them. You can measure it on a Whoop device or an Oura Ring, or now the Apple Watch does have HRV.
Really? Oh.
Yes. You have to go into the app and on the phone, on the iPhone, and it's one of the health metrics now. You have to look for it. But you have to wear the Apple Watch to track it. And there are also add-on apps, by the way, for the iPhone that you can track. Be that as it may, his HRV jumped from the 60s to the 90s without changing anything else, that's quite a big jump. And 90s is almost unheard of. That's crazy great. Right?
Well, that indicates, because I do speak about HRV a lot, that indicates a reduction in that stress response through the nervous system. And there was a guy I had on a couple of weeks ago, Don Moxley. He specializes in HRV. He has some system that he tracks, and I use Whoop. I've been using the Whoop for 3 years. And he works with athletes specifically, and he was kind of saying some of his practices, and his athletes, like what you just said, they would jump from a 60% recovery to 90 HRV, and that was amazing. And I was like, well, my HRV kind of hangs around 111, 120. And he's like, really? And I'm like, yeah, seriously, it does. So HRV is an amazing tracker for the stress response.
Right.
And it's not invasive with these tools as well.
Right. So that's one test. Other tests we use to track cellular stress are the different biological age tests, which look at inflammatory markers. And we can just do blood tests for inflammatory markers like homocysteine or C-reactive protein. But there are two different categories of biological age tests. There's the intracellular, like the telomere length, the DNA methylation, that kind of thing. And then there's the extracellular, which the glycan age is probably the best one for that, where we look at sugar molecules attached to antibodies. And because you can modify those with your lifestyle. And it's a look back for, at least with the glycan age, for a number of months. So it's like an HbA1c test if you're a diabetic, right? You look back and see what your compliance and your success has been over a number of months. And we are looking at these tests in relation to delivering the biohacking IV exosomes and things like that.
Are you testing biomarkers every 3 months or shorter? How often are you doing that?
At the beginning, I like every 3 to 6 months. And then once we know our happy place, I don't think they need to be done that frequently.
And you're testing telomeres. That's something I would love to get tested.
Actually, I've been using the glycan age because it gives us a number of months of look back, where the telomere length may be too long, a look back to help us see the response to something we're trying. Oh, okay. And ultimately, it's like HRV. You have a good night's sleep, your HRV goes up. You want some kind of measure of what you're doing, so you can say, aha, I should just do more of that thing, or I should avoid this one thing that's making me worse.
Yeah. So more refined and more current than the telomeres would be.
Right.
So in your industry and what you're doing now, do you have a lot of competition? I'm sure you have to stay on top of the research as much as possible to stay ahead of the game.
I am always amazed at how many new things there are, or new papers coming out in the scientific literature. One has to cut through literature that's not great and cut through some of the popular stuff that gets published without scientific basis, that's not in scientific journals, on websites and things. A lot of people send me news articles and I'm like, it's not really news, it's just an idea.
Yeah.
But there's not a ton of competition, and I'm, there can be, it doesn't matter. I mean, listen, people people travel far to get stem cells and things. They travel out of the country. They travel out of the US. They can. You don't have to. We don't use or manipulate any tissues here. So I know out of the country, sometimes they use cell lines that have been, allowed to live longer and divide many times. So I don't know what those cells look like. I don't know what their telomere length is. And I want the freshest stuff. So that we buy from labs, reputable FDA compliant labs, ironically, that we have a tracking. It's been tested. We know the protein content of the material. It's basically from the womb to the lab, to the freezer, to my freezer, to the recipient. So it's basically the youngest tissue that you can get. And I'll be honest, we've done stem cells and exosomes. In my own personal use, the exosomes have been as effective as the stem cells with less cost.
I have to ask, because I know people are going to be curious if they are enjoying this conversation as much as I am. What's the price range? Just give me a range. Don't give me for someone who wants to do exosomes for systemic inflammation, autoimmune issues.
Yeah, so we have, I'm able to do here in my office, we have the exosome IV priced at just under $4,000 US currently. And that involves a total particle count of 520 billion, which is a significant dose. I don't think you can find a bigger dose. Now, we realize that those are particles between 50 and 100 nanometers in diameter, which is why they call them nanoparticles. They're about 1/1000th the size of a cell. And not all those particles are active exosomes, but because there's no way to know how many exosomes are in there, we to compare this to another product or what have you, we go with the top particle number, which is 520. For example, if you go to your esthetician and they want to do, a facial with exosomes, maybe some microneedling and facial, you might get 5 billion or 10 billion. So we're doing 520 billion. So that's the difference. And it's fresh. I have a special freezer, so you get a fresh delivery. If we were to do someone's knee, let's say, and we do lots of knees now, all of a sudden I'm doing more knees than spines. If you have degenerated cartilage and you are considered going towards bone on bone, or your doctor says you have arthritis and you really want to avoid a joint replacement, this is one way we can try to do that. And that usually involves 2 doses injected above and below the knee. And that's done at a surgery center under sedation. So with all those additional costs, we have that price just under $10,000 US.
So you're flooding the cells, so you have a higher chance of efficacy that you're going to hit the target, basically.
Well, with the knees, we're very specific about where we deliver. We get specialized MRI sequences. We determine exactly where the bone marrow and the stem cell needs some activity, and we have some wonderful before and after MRIs where we've actually shown enhancement in the thickness of the cartilage after the delivery of the exosomes.
Yeah, so I meant with the nanoparticles, your 500 million, you have a higher chance of efficacy the higher dosage you're going.
I see. So yes, it's 520 billion. But yes, you're correct. Obviously we want a significant number compared to some of these smaller doses that are out there for cosmetic purposes.
Awesome. This has been fascinating. I knew it would be. Have you heard of, I'm just curious, a guy called Sayer G out of Florida? He runs a website called Green Med Info. He talks a lot about exosomes, but from plants, not from humans, and how they tag genetics and have that messenger expression as well. You might be interested to look into what he has to say, because he's actually a really smart guy, and he was one of these guys who was censored, shall we say, for what he was saying over the last few years. But he's really smart. He's got a lot of interesting stuff to say.
I haven't heard of him or the website, but I am aware there are exosomes that come from plants that overlap some of the anti-inflammatory epigenetics
Mhm.
and gene expression in a human. So it gives, a nutritionist can really affect your inflammatory burden, your genetic activity, epigenetic activity through this knowledge. And one of the ways that the nutrition from plants helps us is through their own exosomes, and they do overlap with ours. We share some very primitive um, proteins and genes, and plants can activate them. And we know this. We know what's healthy for us.
Yeah.
You know.
Well, that's it. I really people know already that they just pay me to remind them and hold them
Yeah.
accountable. But people know, like, you, as much as I want you to hire me, you don't really need to hire anybody because you already know the answers. Don't do this, do that. One thing that I love for optimizing stem cells again is going to bed slightly hungry. There is some research supporting that we get the extra dump of human growth hormone. There was a girl in the gym this morning, she's like, I just can't get my gains. And I was like, I bet you're eating late at night. I bet you're eating.
Yeah.
Like, you can see it. It makes such a difference for the healing and regeneration.
I completely agree. I think that I'm going to call it intermittent feeding. And it sounds like we're making this intervention, but really we're designed to eat during the light and not during the dark. So, we're biologically wired for that. So our metabolism moves with that. And if you're eating during the dark phase, you're really messing up your metabolism. You're not going to have your muscle gains. We also probably, I think you might agree, we don't get enough good protein, both amount and quality. Most people don't. I think that those are probably two of the biggest factors I come across that can be optimized.
I'm so glad you said you'll mess up your metabolism eating, because as much as I say it, I'm like, I know you don't like to hear this. I know nobody wants to hear this, but I can tell you my body, the human body, loves going to bed slightly hungry. If you want to see results, look your best, feel your best, grow muscles, heal, you go to bed slightly hungry. But people don't want to hear it now because that's uncomfortable, and you can't eat and watch Netflix before bed.
Well, the problem is we're probably designed to go to sleep right after it gets dark, and we don't. So we get hungry as opposed to being asleep while we're hungry, because then we don't care, right? So I think that people, and I'm one of them, I struggle with this too, right? I'm up late working or reading or watching Netflix or what have you, and yeah, I kind of would like a little snack. So I think you have to be strategic, and you should have a negative caloric snack, some celery or maybe a little
Nobody
bit of
likes
protein.
it.
Yeah.
Yeah, no, I agree. It is a hard thing, but the more you practice it, the easier it gets, I think. Well, thank
Agreed.
you. Where can people learn more about your work and all the fine details?
Thank you. So all of our channels are called Recelebrate. So ReCellEbrate. We have a website, Instagram. We have fun posts on Instagram, TikTok. I have lots of YouTube videos. Just type in Recelebrate, you'll find us, and hopefully we can answer questions or meet some of people who listen to you, and we try to help any way we can. We love new issues, and we'll dig in and research them.
Thank you. This has been fascinating. I think people have learned a lot. I love this topic. It's so awesome.
Thank you so much for having me.
Well, thanks for your time, Dr. Gross. Maybe we'll have you back in the future with some new updates on what's happening in the world of regeneration.
Would love that. Thank you.
Thank you.